Hello everyone, welcome along to the Fertility Support Singapore Instagram Live. Of course it's Thursday night, which means we're live, and tonight's topic is going to be male infertility. So if you just give us a moment here, we are going to add our very special guest tonight. That is Dr Janice Tung. We are so fortunate to have her with us. Bear with me, we're just going to add her now. And this is such an important topic that we're talking about tonight, male infertility. Dr. Janice Tung is going to be our expert. And here she is right now. Hello, Janice. Hello, Doctor.
Hi.
Thank you so much for joining us. Before we start, just tell us where we can find you in Singapore and tell us a bit about your career.
Oh, okay. I just came out of I've been practicing about 10 years. And my clinic can be found in Thomson Medical Center. We are called the O&G Specialist Clinic. My partner is Dr. Low Xiong Fei. He is the medical director of Thomson IVF and Fertility Center. So that's the reason why I'm doing all this fertility work with him.
We're so lucky to have you join us tonight. Normally we have a sort of chat before we go into questions, but actually there's one question that really does sum up tonight's topic, and I just thought it was really good that we just sort of go into it. Thank you so much to everyone who took the time to write in with comments and questions this week. We're going to start with this one. What constitutes male infertility, and when should you get help?
Okay, so essentially male infertility, compared with female infertility at least, it's very easily accessible. It is run. And so male infertility implies that the sperm count and the sperm movement in the semen analysis is less than adequate, which means that generally men with these abnormal parameters may require further treatment, either with IUI or IVF. That means the chances of conceiving naturally without medical aid will be low. And it may not exist in itself. That means couples facing male infertility issues, it may not be separate and aside from women's issues. It may be part of many factors as well, affecting the couple's difficulty and challenges in conceiving. So in general, couples who are facing difficulty, about 30% of them would be faced with this issue of male infertility. Okay, so the abnormal, when I'm talking about the abnormal parameters, I mean when it can be mildly, it can be mild, it can be moderately low, or it can be a very severely low count problem, in which case the treatment options are different.
Okay, you're going to have to, our viewers are going to have to be very patient with me, and so are you, Doctor, with some of the pronunciations of the medical technical terms. So we're going to continue with your questions now. Teratozoospermia. What can we do to improve this? And first of all, did I pronounce it right?
Okay, actually the spelling should be Teratozoospermia. Oh. Yeah, so so I mean, if you break down that word, terato means different looking, different appearance, difference in appearance. So teratozoospermia means sperm that look different from what we expect. So in general, the international criteria states that 4%, only 4% of the sperm need to look a certain defined manner. Obviously, it is this low because most sperm do not fall into that category. So we see a lot of men, actually it's pretty common. In fact, it is almost the norm to see men who don't meet this criteria. That means either 0% or less than 1% or even like 2% of their sperm actually look like this defined structure. Most of their sperm don't. So seeing as it is that it is the norm, and it is actually a rarity for people to meet the criteria of 4%, this men we find generally able to father children without medical aid. So we do not think that this condition, this Teratozoospermia, is serious enough to warrant a lot of attention. The general advice to improve sperm quality overall, regardless of the sperm result, actually, is to keep the testes cool. That means certain things like avoiding tight-fitting underwear, jeans, hot spas, showers. Some association with putting the phone in the front pocket, using the laptop on the lap. These things that may cause thermal or vibration injury. Such as working with heavy machinery, long frequent hours at bicycling and or motorcycles, and prolonged contact with stove, if you're a chef, for instance. These are things that may affect the sperm quality and health and should be avoided if possible. Then obviously certain lifestyle habits such as smoking, excessive alcohol intake, caffeine has been shown to have an impact as well. So limit it to 1 cup a day if you really have to. And taking you can consider taking a daily antioxidant multivitamin as well. This would be things that contain vitamin A, C, E, zinc, selenium. Okay, and these are often found in men's performance vitamins.
Doctor, you've mentioned lots of things. There are things to avoid. You've mentioned the multivitamin. Maybe this next question you've already covered, but one of our viewers has asked, how can we improve sperm morphology?
Exactly what I've mentioned above.
Right, okay, so that covers that one. Okay, so we'll move on to sort of success rates of IVF and ICSI, and severe, oh gosh, this is another word. This is why I didn't enter the medical field. I think that's obvious for everyone watching right now. Oligotheneterospermia.
Teratozoospermia. Yes, you got that right anyway. Yes. Okay, so okay, I will address, okay. Basically oligos, now you caught me there as well.
Sorry.
Teratozoospermia just simply refers to oligo, meaning a very low sperm count. As you know, it refers to the sperm motility, the sperm movement not being less than adequate, and terato, as I mentioned, is the sperm morphology. So usually sperm morphology, as I said, we really quite disregard. Most of the time we find teratozoospermia. So my usual phrase to patients is good-looking soldiers, ugly-looking soldiers, they're still soldiers. They're functional. Okay, so the sperm count, however, and the movement are very important parameters, and so when they're severely low, it does affect the success rates of natural conception. IVF tends to be able to improve this pregnancy rates by a great deal. In fact, it's thought that it may be able to restore the male fertility to that of someone who has normal sperm parameters. The ideal behind it is that essentially, if let's say for instance you only the criteria for sperm count, for instance, is 15 million per mil of semen. If you have 2 million, if you have 10 eggs from IVF, you are going to be able to find 10 sperm to sperm. So that's the reason why the success rates for such couples facing male infertility issues can be a lot more satisfying than, let's say, a couple that is having unknown difficulty, as in it's unexplained why they're having difficulty.
Okay, just following on from your question now, thank you to Sue Annas, who's just messaged right now. What about Azoospermia? And could you explain what that means to the likes of me?
There's a previous question. I think that somewhere in the previous questions, there's also another question about azoospermia. And azoospermia is very different than, in this case, azoospermia refers to the fact that there's zero sperm found in the semen. Zero. Okay, so in which case, there's no sperm. We can't work without any sperm. So depending on the reason for azoospermia, whether it's an obstructive cause or a production cause, the treatment options are pretty limited. So if it, for instance, there are some men genetically, they just don't produce any sperm and it's due to a genetic defect. In such cases, donor sperm is the only available treatment because they're not producing any sperm. There's no way we can retrieve any sperm. For men with some obstructive cause, we can try to retrieve sperm directly from the testis through a surgery. We call it MISA-TISA, but in any case, what it constitutes is looking under the microscope at the testis. And I mean, that's during the surgery, we cut open and then we look at the testis under the microscope and we pick out what we can. Yeah. So if we are able to retrieve at least a few sperm, then they may be applied to IVF and sperm injection in order to try and achieve pregnancy. I see a comment there.
Yes, lots of love for you, Dr. Janice, tonight. All right, so this next question really takes me back, and it was such an agonizing wait after sperm met egg, and then we had a telephone call from the embryologist, and I know exactly what this person is going through. And their question is, when a blastocyst stops growing after day 3 or 4, is sperm a high possible reason for this cause?
Okay, so to be honest, there's really no way of telling. When the blastocyst stops growing, essentially it means that the quality of the, I mean, it generally means that the quality of the embryo is not quite adequate. But it may also mean sometimes that for whatever reasons, the embryo is not suitable to be cultured in the medium. Okay, so there's an artificial component to it because the media we provide to grow the embryos in is based on our best evidence and best technology. So that may change in future, and it may be different in future. So I wouldn't always say that it's completely the genetic quality of the blastocyst, but certainly that is a big part of it. And the genetic quality of the embryo comes from both the egg as well as the sperm. So it will be quite difficult to actually pinpoint exactly which component is bigger. Yeah, we can look at certain circumstantial factors such as the age of the woman, the age of the man, other factors such as very poor sperm parameters and sperm quality may indicate a larger impact from there. But there is really no way of pinpointing the specific reasons for it.
It's so hard because when you're going through IVF, all you want are answers and things to pinpoint and blame and sort of have to sort of keep you going. So yeah, it's really hard. You've just got to go with it. Okay, does it make it easier if it's male infertility issues? And in particular, a low sperm count? I think this is a question regarding sort of, IVF, I guess, rather than sort of an egg issue.
So as in, meaning that if the sperm count is severely low, is it difficult? Yes, certainly. In general, for IVF, I mean, for any means of conception, whether natural trying, IUI, or IVF, whenever there are poor parameters such as a low sperm count or very diminished ovarian reserve, it would certainly affect the chances. But compared to poor egg count and poor egg quality, when it comes to a sperm issue, I would say it's still the IVF successes are still better than for the other reasons. And that's the reason why generally when we face couples, especially with a young lady, men with male infertility issues, we tend to be more hopeful, give them more, yeah.
As opposed to someone like me who's old with older eggs. So, and then you're really got your fingers crossed. Yeah. So you touched on, what happens when the sperm count is 0. And you mentioned donor sperm there, and someone's asked us, is donor sperm allowed in Singapore?
Yes. Within the government hospital, there is available donor sperm banks. Or in private centers, generally, we ask our patients to you can purchase the donor sperm online. Yeah, from certain banks that we work with. So the sperm is imported into Singapore.
Someone's just messaged us with a live question now. You touched on sort of the multivitamin and just avoiding heat and the mobile phone in the pocket. But we have a question here that says, is strict dietary, does a strict diet play a part for both genders when it comes to sort of fertility treatments?
Okay. I could take the question the other way and think that it's a question about sexing, but in which case I'll tell you there is no real dietary factors associated with either sex. But anyway, the only real dietary factor that is proven would be caffeine. Avoiding caffeine or excessive amounts of caffeine for both wife and husband are important in helping with the quality of the eggs and the quality of the sperm. Other than that, fertility diet in general is a health diet. It means varied eating from the varied food groups, as well as making sure that you have less red meat, carbs, more fruits and vegetables. Yes, there is no true anything in particular to take that would improve the fertility.
Here's another one. Is there a dead end scenario for male infertility, such as when does one decide to go for donor sperm?
That would be your Azoospermia. Yes. Generally, again, depends on the cause of the Azoospermia. As I mentioned, we could try to retrieve sperm directly from the testes, failing which that would be donor sperm. And if it's a genetic issue where the sperm production is affected, then that would also require usually donor sperm. In any case, if there is a sperm production issue and it's a genetic one, you have to understand that even on the off chance that we are able to get some sperm and you do conceive, your progeny, that means your next generation, may face the same issues as you did, with their sperm quality and sperm production.
So we've spoken a lot sort of about the science of all of this. There is obviously like a lot of emotion and sensitivity surrounding this subject, so much so that before dinner tonight I even said to my husband, I admit, at least for us, it was an egg issue, and I just accept that. I can deal with that. I feel like I have the mental strength to accept it and move on and all the rest of it. But perhaps for my husband, if it was an issue that was sort of, the fault was it was his fault that we were struggling, maybe he would have really struggled with this. And I think we sort of speak for a lot of couples. And so we had just this amazing question come in. We sort of said behind the scenes that this person gets the star question this week. And the question is, how to support your husband emotionally in this journey of infertility?
I mean, I would like to expand a little. Actually, as you mentioned, this whole emotional part and is actually the main part of IVF treatment. It's really not the science is just the small part, because we are looking at a success rate of 30%, maybe 40%. So we're dealing with disappointment most of the time, not successes. So therefore, actually, the stress, anxiety, the emotional part of it is really, really important for both wife and husband. But I give this question a star, yes, because often the husband is neglected in this whole process because yeah, it's just thought that they would be more stoic, they would be more, I mean, they're the pillar of strength, and so they're not really allowed to show their emotions. And I would think that it is very difficult actually if um, and most wives, I suppose, or women, the logic behind it is that if the man has a problem, the treatment is, administered on the woman. If you think about it, the needles and everything is the woman going through it. So, I mean, most people would just say, in that case, why should I even bother how the husband feels? I'm the one going through all the pain, So that's where this wife, her husband is really lucky. Yeah, because she has actually considered that yes, it can be very stressful for the husband as well, especially when he feels helpless because he can't he's not undergoing the pain of the treatment and all the invasiveness of all the egg pickup and the transfer procedures. I mean, I'm sure lying down there with your legs apart is not the most, it's really not a pleasant experience no matter how you put it. Yeah. So yeah, so I give her top marks for being able to consider her husband's emotions, and that is actually just the best way of dealing with it, the ability to even just recognize that he may be affected equally, if not more, if he was the one that is supposedly the indication for having to go through IVF in the first place. So the fact that you recognize it, I think he will appreciate it. Yes. I think the other thing is husbands themselves actually can play a more active role in trying to go through the clinic visits with the wife, as well as helping with the needle injections, and basically taking a more active role. Some men, I suppose, emotionally reject the fact that they're the indication for the IVF treatment, and they sort of I think it's a denial process. Yeah, so they tend to isolate themselves, and that might make it worse for the wife to be supportive of the husband. Yeah, so I think open communication is the key.
I guess following on from that is what support is there for male infertility here in Singapore?
Actually, this I suppose you could set up something. Yeah, gather all the husbands.
I know. Band them all together. So let's go back to the more sort of scientific side of things. Got a great question here. Morphology less than 4. I know you mentioned the numbers earlier. Can it be the reason for not conceiving?
The short answer to that is no. Okay. Generally, as I mentioned, we still consider the sperm check satisfactory because there's just way too many people who are able to conceive naturally with such parameters. So the thing is, if let's say such a parameter is found and nothing else is found, I would put you under the unexplained category, which 15% of couples fall under anyway. So essentially, it is not known why that you're having difficulty. All the above things that I mentioned to help improve sperm quality or try to will apply. But all the other things as well in general to improve your chances of conceiving.
Here's a scientific word for you, so bear with me. Hypogonadism. Is there any treatment? Can you do anything to improve the quality?
Okay, so again, that depends on the hypogonadism. So for instance, if it is due to a primary hypogonadism, which means that there is primary testicular failure, which means the testis as an organ has just stopped working and it's not producing sperm or testosterone, the male hormone, then in that case, it's very difficult. There is hardly any treatment. As long as there's still sperm found in the semen, then IVF as soon as possible. Yeah. So however, if there's other reasons, for instance, where we consider it as a low stimulus from the brain to the testis, yeah. So in such cases, there are certain medications that we can try to give to improve sperm production. This one you discuss with your gynae. Okay. So in these cases, there are certain treatments, but a lot of these treatments, they are new. They are still under research. There is some evidence to show benefit, but yeah, the gynae will discuss with you the pros and cons of starting on these medications.
Will the sperm quality affect the percentage of fertilisation, even when it's done via ICSI?
Well, the sperm quality, is it? Effect? Oh, certainly. As I mentioned, with the blastocyst question, when the fertilization rates are poor with ICSI, we will have to take a look at the quality of the eggs and the quality of the sperm, both. But if the fertilization
and
rates,
I know we've
it's okay. Go ahead.
I know we've covered it before. We do have more people tuning in now than we did at the start. It's a question that keeps on being repeated. All of us want that secret, that formula to crack infertility. And the question again is, so I'm sorry to get you to repeat yourself, can you name some food or vitamins that can increase sperm number count?
Really?
Yes.
How about aphrodisiacs, like oysters, to have more sex?
Right.
No, there isn't. I think the important thing is not to be too stressed over every little thing. To keep an open mind, have frank discussions with your partner as well as your doctor and the nurses regarding your treatment plan. Have goals, time frames, especially time frames, I think, that will help you to move your course of action along, so that you're not so stressed when that that urine pregnancy test comes back as negative at a particular cycle. You need most couples find it helpful to have an idea what is the next course of action when the result is negative. I mean, I think you get what I mean by that. Yeah, so they find it helpful that there's something to move on. So yeah, I think your attention should be focused on these matters as opposed to what you're doing with your life and your diet. Okay. The thing is, some ladies, some couples, they do consult the traditional Chinese medicine practitioners, the TCM practitioners, who will spend a lot more effort than us reviewing your entire dietary plan. Yeah, they may have some suggestions based on your tea and your yin and yang. I don't propose to be an expert on this, but yeah, they may have suggestions on what you should be eating and not eating. Then you may take it from there.
And just finally, because we've got 1 more minute left of your time, since the start of your career, are you seeing more and more issues regarding sperm with your cases? Has that increased over the years?
Actually, it has, but nobody really knows the reason why. I mean, there's been talk about a global decline in sperm quality. Everyone's so hyped up about that because generally anything that defines male and female gender boundaries always raises a lot of responses. But the thing is, I would think that it's actually more likely that it's because more people are coming forth, more young couples are just coming forward quite early on to screen. And so we are picking up more on this. Whereas in the past, I think it's not so, this infertility issue is a lot more low profile. People tend not to talk about it. They tend not to seek treatment until very late, or sometimes they are just content to remain childless because there's such a stigma against fertility evaluation and treatment. And a lot of men are actually not, even if the wife step forward to get checked, usually the men don't. But now it's not the case. A lot of people recognize that the male part is important. And so a lot of men come forward with their wives. And I think that's the reason why we're seeing more of these cases.
Okay, Dr. Janice, you've been a real hit with everyone tonight. Thank you so much. And just we've learned so much, and just thank you for sharing your expertise and, well, just giving so many members of this community hope for the future. So just thank you.
Thank you. Thanks for the invite. I just hope this helps.
Of course. Thank you, everyone. Appreciate all your questions in advance, as well as questions and comments on the night as well. And we'll see you next week. Thank you, Dr. Janice.
Thank you.
Bye.
Bye-bye.